Hi, Kevin Henry, the Managing Editor of Dental Economics, here today at the CDA annual session in Anaheim, here with Dr. Todd Morgan. Todd has just been talking at this meeting about sleep apnea and dentistry and the connection there and what dentists need to know. So I guess the first question is, what do dentists need to know about sleep apnea?
Oh boy, well that's a loaded question. We need to know first of all that they're pervasive in our practices. We have abounding amounts of patients, they just waiting to be found. We've collected data on surveys finding anywhere from 30 to 60% of males that walk through your door as a dentist need a sleep study that need to be worked up. So first of all, know that there's lots of patients that need treatment. They're hugely underdiagnosed, and we need dentists to get on board with this treatment and get going.
I know a lot of dentists are going, okay, how do I break in? Is this something I even want to get involved with? What do you say to that?
Well, in my case, I had a very slow, gradual education. I started way back in 1990 with a few cases and a nurturing sleep doc, and we just brought it along very slowly. So I learned by osmosis. But nowadays, to get going in it, really take a good quality course. And the way to start is research the best courses. I'm not really in a position to recommend a specific one, but there are some out there that are hands-on. You want to choose a practitioner that is not heavily sponsored. Hands-on, small group. Sometimes they're in the practitioner's office. You get really up-close personal attention in those courses. So I look for one like that, and also attend the annual session of the American Academy of Dental Sleep Medicine.
Okay.
That's your source for the latest scientific information, innovations, the latest tricks and things to do to keep patients comfortable wearing them. So to get going, you got to dive in. Treat your family and your friends first. See how that goes. They won't get too mad at you if they have problems. And try it on yourself. Probably a lot of dentists need treatment too. So I'd start slow, try a few cases, take a hands-on course, and attend the scientific meeting at the Academy.
Can you give our viewers maybe a one-minute synopsis of what you talked about here in Anaheim?
Sure. Well, I tried to cram 5 hours of information into 2.5, but so it went fast, and it turns out that the content of the lecture was probably a little bit too flavored scientifically for the hygienists and the dental assistants that were there. But a number of dentists came up after who had a little bit of experience in the field, and they said, what you said and some of the tips that you gave in inserting oral appliances were great. Some of the studies that we've recently done, we had a study that ended in 2007 where we're just now learning a lot about the data we collected, and a lot of that has to do with which patients, what appliance to use, how much vertical to add, the gender differences among patients. So there's a lot of really cool new information that this crowd got that other people haven't heard of. So,
what's maybe one or two questions that you would kind of ask afterwards, or maybe some of the prevailing questions you keep hearing?
Well, yeah, a lot of the questions were still about, how do I start? And so I know it's easy for me to tell people what to do, but actually jumping in and starting it is a little scary. You need to understand some of the sleep medicine aspects. The best way to do that is to get a sleep doc on board with you, approach them in a humble way. We know that CPAP, the pressure devices, at least half of the people that try those don't continue with them. So those are the patients that are primed and ready, and the sleep doc needs a place to help try and send them to get help. So he's ready to give you those patients, but if you approach them in a way that, please, I want to learn this science, and will you help me learn this, and we'll learn together, and I've got this service to offer your patients. I think that's the best way to get going. Find a mentor for the sleep side.
And in a minute, can you tell me what this has done for your practice?
Well, it's completely changed the fabric of my practice over the years. I started as a general dentist in 1986, and by 1995 I was doing several appliances a month, and now it's almost 50% of my practice. I'll get 3 to 4 patients a day, new patients a day for sleep apnea, and it's a tremendous boon economically too. we don't have a recession in my practice. You know, dentistry, you know, typically like a lot went down. I didn't do a lot of cosmetic, but bread and butter stuff stayed okay. But the sleep is surging, and that keeps my production up. And I feel like my practice is recession-proof.
Is there a website where somebody can learn more about your practice?
Yeah, you can go to zerosnore.com, Z-E-R-O, and you'll see me there. You can get a ton of good information on AADSM, American Academy of Dental Sleep Medicine.org. And you can take a look and see when the meetings are. We run novice meetings a couple times a year, and then the main event is the scientific meeting. We do once a year. This year in San Antonio, if you publish this in time, June 4th, 5th, it's one of the best programs we're ever going to have, mainly because I'm the program chair.
Oh, there you go.
Yeah.
So, you know it's going to be good stuff. So, Dr. Morgan, thanks for the time.
Okay, thank you very much.